Hello, I'm Glenn Taylor, CEO of the Nursing and Midwifery Health Program Victoria. I'm really pleased to be here today to talk to you about our organisation, the model that we work under, and the sorts of supports that we provide to nurses and midwives throughout Victoria. The thing that's really important for everyone to remember is that nurses and midwives are first and foremost human. They're mothers, fathers, brothers, sisters, daughters, sons, and community members. They've got human sensitivities, likes, dislikes, and they come with flaws and imperfections. They're people first. A qualification in nursing or midwifery doesn't protect people from nurses and midwives from becoming substance addicted or experiencing health concerns in relation to their mental health or anything else in that regard. There was limited information available or research that had been done on nurses and midwives and the prevalence of alcohol and drugs or mental health concerns in their lives prior to the nursing and midwifery health program commencing. What we do know though is that nurses work in a high-risk environment for substance misuse and due to increasing and unrelenting professional stress and easy access to drugs and work-related stress. Local academic Dr. Kelly Berryman did some work in the field and she found that nurses misusing drugs and alcohol are more likely to suffer enormous guilt and condemnation by society because of the professional role that they play. And it develops into a secretive behaviour and they lose control and substance use becomes hazardous, affecting their personal and then their professional lives. It was also known that risk factors for nurses developing substance problems includes work and study related stress, actual and vicarious trauma, a lack of awareness of the impact of substance use, and a fear of ramifications for seeking help. Further research was undertaken, and it was shown that there were a number of risk factors associated with working as a nurse or a midwife. Most notably, the undeveloped opportunities for debriefing, reflection, and peer supervision, or just being able to talk about the sorts of high pressures and patient acuity that people were experiencing in the workplace. Also in 2005, there was some research undertaken by a working group that formed this organisation and it found that there was a number of issues which were significant for nurses and midwives who had experienced a health concern. Those included fear, shame, guilt, isolation and loneliness. The fear was the most significant component, and that included the fear of being identified as being a nurse who had a concern with their health, or the fear of losing their job, or the fear of losing their registration, or the fear of being isolated and identified and labelled as someone who had health concerns. The Nursing and Midwifery Health Program Victoria is an organisation that was driven from the ground up. It was initially instigated by some concerned nurses who engaged the Australian Nursing Federation of the day and also the Nurses Board of Victoria. Together they worked to develop the model and instigate the program back in 2006. And between 2006 and 2013, the program was funded through nurse registration through the Nurses Board of Victoria. The mission of the organisation is to be an initial point of contact or referral and case management for support for those people who need it. It's basically a safe entry point into the service system. It's also designed to reduce the risks of those using services where nurses and midwives operate, and also providing support to employers managing those people with health concerns. In addition, the organisation provides support to help the nurse regain optimum health and to ensure the support and safety for the public. It also implements strategies to assist the nurse or midwife's recovery to an optimum health status. And it also will attend and support the nurse throughout their ARPA process if that's indicated. So what does the organisation provide? Well, it's basically a free service. It's accessible, so there's no great waiting list for people. It provides a safe and secure place for people to come and feel comfortable talking about their very sensitive and concerning stories. We provide confidentiality. We're an independent organisation and we do take a preventative focus. Well, we're also told it's a great place just to be heard and to have people's concerns validated. We do care for people. We provide ongoing support. It's health promotion focused, and we provide a non-judgmental approach and a nurse-sensitive practice. We understand the sensitivities to working as a nurse or midwife, and we understand that it can be very, very difficult to approach the workplace or to approach some of the challenges that are associated with working as a nurse with these types of issues in play. We operate under a very simple model. the majority of nurses or midwives, about 90% people who come to us, come as what we call self-referrals. About 5% come as what we call employer-assisted referrals, and about 5% of people are referred by AHPRA. Basically, when people come to us, it's a very simple assessment process. They tell us their story, we get a sense of what the issues are, and together we develop a plan. And that plan is something that that person drives, and we help them to instigate and we'll help them to deliver on that. Throughout the process, we'll check in with them, we'll help refer them on to other people if that's required, such as doctors or specialists or counselling services, which can extend beyond our service. And we'll also help them get back into the workplace, or help keep them there if that's something that they want to do. And in most cases, we're very successful in getting people back into the workplace or helping keep them there. So what have we been able to help people to achieve? Well, about 89% of the nurses and midwives who've engaged with our service have developed what we call a positive therapeutic process or relationship, which means that they've trusted the service and trusted the staff that have worked there and been able to develop a platform for their wellness. About 2/3 of the people who've engaged the nursing and midwifery health program have displayed a significant behaviour change, which has resulted in improved health status at the time of their separation from us. And about 81% of the nurses and midwives that we've worked with, we've been able to support to either remain at work, or they've returned to work, or they have a plan to return to work as a result of the engagement with us. As part of today's presentation, I thought it might be helpful to identify some things to help employers to be able to identify concerns in their nursing and midwifery staff in the event that they might be experiencing a substance concern or a mental health concern. Firstly, the physical concerns or the physical identifications or signs and symptoms include, or may include, bloodshot eyes or pupils that are smaller or larger than normal, sudden weight loss or weight gain, shakes, tremors, altered speech or impaired coordination, deterioration in personal grooming or physical appearance, unexplained injuries or accidents, or unusual smells on the breath, body or clothing. Now, of course, these individually may or may not be of concern, but it might be over time that you as an employer or someone who's managing someone with these types of symptoms may put these things together and just start to ask some questions. Some behavioural signs and symptoms may include the following: making themselves unavailable to work or becoming disconnected from work, a drop in performance, becoming disinterested or decreased motivation, having complaints by colleagues or supervisors about their performance, unusual or unexplained need for money or complaints about financial stress, borrowing or stealing can also be something as a sign or a symptom, becoming withdrawn, secretive or suspicious, or unusually argumentative or combative. A sudden change in relationships or friends can also be an indicator. Psychological signs and symptoms might include the following: unexplained change in personality or attitude, a sudden mood change, irritability or angry outbursts, periods of unusual hyperactivity or agitation, a lack of motivation or an inability to focus, appearing lethargic or just spaced out, appearing fearful, withdrawn, anxious or paranoid for no apparent reason can also be some warning signs that you as a manager or employer may be concerned about. I thought it might be helpful to present a couple of case studies that we've worked with at the Nursing and Midwifery Health Program Victoria. The first one is around substance use, and it was a 47-year-old single mother of 3 who'd been a long full-time employee with unbroken service at a major health network in Victoria. She had a sudden request for a move to bank with the same network. She had a history of chronic back injury and poor pain management, and she requested increase in shifts. In addition to this, she was becoming secretive, irritable and unaccountable. There was a discrepancy around the drug counts with the dangerous drugs that where she was working and the administration of this. And it was ultimately found that she'd been diverting medications in places that she'd been working. As a result, this was identified and there was an employer-assisted referral made to our organisation. And where it went to from there was really interesting, and there's been some great outcomes. Firstly, the lady in question, she came to us and she disclosed that she'd been experiencing some real troubles with her family. There'd been conflict in the family, and in addition to this, she hadn't been able to manage her pain, which she'd had for about 25 years from a previous injury. she was too scared and too fearful to ask for anyone for help, so she took it upon herself to try and manage her own pain and her own health concerns. She did have a doctor, which she was working with, but the pain wasn't being managed correctly or adequately, hence her need to start to divert medications from work. Now, she realised that this was a major concern and it was outside of her scope and it was unacceptable to her. But the pain that she was experiencing was just so great that she felt so desperate that she needed to do something about this. As a result, we worked with her. We referred her to a pain management specialist and also to an addiction management specialist. And as a result, she's been able to manage her pain and been able to get onto a schedule and regime that is managing her pain correctly now. And she continues to work with us about weekly to fortnightly, just to work in and to make sure that she's managing the stresses and concerns that she experiences as a regular nurse and a mother and a member of society. The next case study is about a 32-year-old single woman who came to us with some concerns around her mental health. She'd recently moved to a new department in the hospital that she was working in. She was described as a solid citizen, a great colleague with a great work ethic. She had a perceived loss of confidence and gradual withdrawal. She had increased absenteeism and failed to present at work one day. There was a welfare check done and discovered that she had mental health concerns. She was encouraged to come and see us as a self-referral, which she did. And as a result, we've been able to help her to arrest the concerns that she had and be able to help her get back to work. It turns out that she was experiencing a long-term mental health concern based around her mood disorder. She had depression, and we were able to assist her to be able to get back on track. She was able to see a psychiatrist. Her medications were reviewed, and she's now stabilised, and her life is back on track. She continues to see us about once a month, just to keep on track with things. So how can the Nursing and Midwifery Health Program Victoria support you to support your workforce? Well, here's a range of things that I'll be covering in the next few slides so that you can be really sure about what it is that we do and that we're available to assist with. Firstly, what we provide is an industry-specific health-related information, guidance and support service for nurses, midwives and their employers. By this we mean nurses for nurses, and this model we've been told is very successful given the intimate knowledge that we as nurses have about the nursing and midwifery industry. We have expertise in substance use management and mental health concerns. We've got a broad-based and specific information service available via phone, email or in person. We're available as a response or support for an impaired nurse. And we're available for guidance and support for the employer or the agency proprietor, if that's the case. The next thing we're able to provide is access to online information and resources for everyone. The NMHP website has information about the organisation and health-related issues, including links to alternate services and additional support. We're also able to tailor education and information forums for nurses, midwives, employers and organisations. This may also include human resource departments. We can provide sessions which are designed specifically for the needs of the audience. Topics for nurses may include stress management, self-care strategies, or achieving work-life balance. Topics for agencies or employers may include promoting health and preventing illness, identifying the impaired nurse, managing the nurse's self-care and safe return to work. We're also able to provide individual assessment, case management and support for nurses and midwives. The individual assessment is done, the care planning, the referral, the treatment and the liaison is undertaken all by us as nurses within the service. We provide case management and coordination of the nurse's care, referral to specialist health services, and regular treatment reviews, relapse prevention and monitoring. We also provide coordination and support of the re-entry to work plan in collaboration with the employer. One of the aspects of our program that we're particularly proud of and that's been very successful is our peer support group. It's facilitated by one of our case managers and offers practical advice and support for participants of the program, and it complements our individual support plan. It covers issues relevant to nurses engaged with us, including such things as health issues and professional concerns. Program participants may attend as many or as few groups as they choose. We also provide group debriefing for nurses and employers. The service will attend health services or organisations providing support to groups which have experienced an event or events which have caused collective distress or concern to any population. The goals, needs and requirements are identified by the organisation's management to assist us at the NMHP in understanding the issues. This is done before being made available to that organisation and its staff. Another function of the NMHP is providing employee case-by-case guidance and support for employers. Management can contact the Nursing and Midwifery Health Program Victoria for advice and support regarding the management of a specific nurse in its organisation, where they believe the person's health is impaired or has the likelihood to become impaired. The NMHP will also provide advice and guidance on broad and general themes of nurses' health and wellness, which may cut across the agency. We will also provide onward referral to specialists and trusted health providers for nurses and midwives. The NMHP will refer these people onto specialist supports where a more detailed or more specific skill set is required, such as a nurse experiencing domestic violence. Here's a list of references that I've used in today's presentation. And finally, before I finish, it's important to know that there's supports available to other disciplines across other states and territories around Australia. These include examples such as Beyond Blue, Lifeline, Are You OK?, local area mental health services, local alcohol and drug services, and employer assistance programs attached to St John of God. Thank you for your attention today. I do hope that you've learnt more about the organisation and that you feel free to contact us if you need any assistance, any information or any advice about the service or the supports available.